Hi, everyone. I want to welcome you all to our third webinar in our series, Our Daughters, Our Future, an educational series exploring girls' mental health and wellness. At Gateways, we recognize that mental illness and challenges to children's social emotional health can be a barrier to learning, and too often there is a stigma around mental illness. It's something that people don't like to talk about. Our goals for this series are to raise awareness and reduce the stigma around mental illness and children's mental health, and to give all of us insight into strategies that we can use to do our part in supporting our young people, because we believe that the more people understand what mental illness is and how we can play a role in supporting our young people, the better off their suffering will be. February is Jewish Disability Awareness, Acceptance, and Inclusion Month, and this year, mental health is an area of focus. Today's webinar is focused on identifying eating disorders and promoting resilience. We are so grateful to the Miriam Fund of Boston's Combined Jewish Philanthropies for sponsoring this series. The Miriam Fund is committed to creating a world that expands opportunities for women and girls. The agenda for this evening is to hear first from Anastasia, who will share her moving story of living with an eating disorder, followed by our speaker, Dr. Allyson Cherkasky. We encourage you to use the chat function to the panelists and attendees to ask any questions that you have throughout the presentation. And then after Dr. Cherkasky is finished, Dr. Rachel Shine will pose all of the questions that came up throughout the presentation. I'm now going to turn it over to Dr. Rachel Shine to introduce our speakers.
Thank you, Sharon. Hello, everybody. Welcome. We are so thrilled to have all of you join us for this evening's webinar. I am thrilled to introduce our speakers tonight. First is Anastasia Vlasova. I got it sort of right, who is a 12th grader at South Lakes High School in Virginia. Anastasia developed a passion for mental health after seeing her friends and family struggle with anxiety and depression. Her observations and personal mental health struggles led her to speak at the Josh Anderson Foundation's 2019 annual ball, where she shared a teen's perspective on mental health, as well as her hope of destigmatizing it. Anastasia is with us tonight to share with us her own experience with eating disorders, and to talk about her journey. She currently serves as the Vice President of Future Business Leaders of America and the co-president of Our Minds Matter, a mental health club at her high school, as well as the creative director of This Is My Brave Teens, which is what brings her to us tonight, is her work with This Is My Brave. Our presenter, Dr. Allyson Cherkasky, is an associate professor and psychologist at William James College, with an area of emphasis in health and behavioral medicine. Dr. Cherkasky has been at William James College for 15 years, educating the future psychologists of the world and mental health counselors, and specializes in health psychology, behavioral medicine, and eating disorders. Prior to her work at William James College, she was the clinical director of eating disorders at Walden Behavioral Healthcare in Waltham, Massachusetts, and has worked at many other facilities focused on eating disorders as well. So we are so excited to have you join us today, and can't wait to hear what you have to share with us. All right, take it away.
So I think, Anastasia, you're going to start with your story, which I'm so excited to hear.
Yeah, so I'm going to talk about a bit of a lesser known eating disorder, which is binge eating disorder, which is what I struggled with for roughly 5 years. And although my eating disorder officially began in 8th grade, I first noticed having body image issues when I was in 5th grade. So I have this distinct memory of me being in 5th grade, going to the beach with my family and a couple of friends. And I remember looking down at my stomach and noticed that it was protruding a little bit more than the other girls that I was with. And so just that single memory made me want to suck in my stomach ever since then, whenever I walked around. And it just made me more conscious about my appearance, what I look like, how others perceive me. And so ever since then, I've been having a lot of body image struggles. And I think that definitely worsened in middle school and was one of the causes of my eating disorder. Middle school is that time when everyone is a little bit more self-conscious, unfortunately, because our bodies are changing, we're going through puberty, we're meeting new people, and just growing up and becoming more aware of how we look and others perceive us. In 8th grade, I was continuing to be a competitive tennis player, and I wanted nothing more than to get stronger and become a better athlete on the court. And also my coach had encouraged me to start working out because I was going through a bit of a growth spurt. And so my bones were growing a lot more than my muscle. And so I was kind of weak in areas of my body. And so I needed to strengthen that up. And so I started going to the gym and researching different workouts and exercise regimes. And then also I started getting into nutrition, but I didn't really have any sort of formal nutrition education because in school, we're only taught that core of like vegetables, carbs, well, vegetables are carbs, but I mean, vegetable fruit intake and then protein and then healthy fats, but they don't really go into in depth about what kind of nutrition you should be striving to have every single day. And so I turned to the internet, specifically just Google and researching whatever articles came up first about how to gain lean muscle and lose fat. And then I also turned to Instagram and following different fitness influencers on there or models or other tennis players that I looked up to. And I basically started comparing my physical appearance to the appearance of, 20-year-olds who had been training professionally in different sports. And I started noticing that my body didn't look like theirs. And so a lot of my motivations for fitness and nutrition were physically motivated because at that time, I didn't understand what living a healthy, sustainable lifestyle really was. All I saw was what I saw in the mirror. And that's kind of what I used as motivation to work out and to play tennis longer and to make changes to my dietary habits. In 8th grade, I started excessively working out. So I already had around 5 days, sometimes even 7 days a week of tennis practice on top of tournaments nearly every single weekend. So I was a very, very active kid. And I decided that I wanted to supplement my tennis practices with working out at the gym. And so there were multiple days a week that I would go to my 2-hour tennis practices, and then I would follow up with an hour of weightlifting or doing even more cardio, like running several miles on the treadmill at the gym. And at the time, I guess I was going through a bit of an endorphin rush or runner's high, I guess you could call it. And so for the few weeks or even months that I was doing it, it felt okay. I just thought that I was super active and super strong, and I was proud of myself for being so active and for reaching all of these fitness goals. But what I didn't realize was that the lifestyle that I started to cultivate was very unsustainable. And so then after those few months of doing rigorous exercise and also underfeeding myself, because what I didn't mention before is that as I was doing all of that nutrition research, I also was starting to do a calorie deficit, because when I searched up how to lose fat and how to gain lean muscle on the internet, the primary thing that came up was you have to go into a calorie deficit. So start cutting calories, start restricting, start eating less sugar, less carbs. And so there was such a plethora of information online about what kind of diets I should have. There was keto, there was paleo, there was low fat, no sugar, all of these really restrictive diets that I simply was not ready for. And also I shouldn't have been trying out because I was so active, and these diets basically demanded me to reduce my calorie intake by a lot, which wouldn't fuel me enough to perform best on the court. And so this combination of over-exercising and under-eating resulted in me feeling very deprived, especially after months of doing so. And so throughout the week, I would, try to restrict, and I would usually try to consume around 1,500 to 1,600 calories, even though I was burning probably around 25, possibly 3,000 or more calories being so active. I was extremely underfed. And then I remember the first time that I had my binge, I guess you could call it. And that was when my mom was going off on a work trip, and I was just home with my dad because my sister was in college. And looking back, I was going through a lot of stress regarding, friendships, because I was in a lot of toxic friendships in middle school. I also was really stressed with my workload, my academic workload, on top of my tennis performance, because I hadn't been performing that well on the court and losing a lot of tournaments. And my mom was gone, and my relationship with my dad was really strained. And so there were just a lot of different factors that were making me extremely stressed and just upset with myself and upset with life. And I didn't really have any healthy coping mechanisms at the time, because I didn't know much about mental health, which is really funny to think about now because of how involved I am in the mental health space and how much I've learned over the past few years. But yeah, at the time when I was 13, 14 years old, I really didn't know what depression was, or how I could healthily deal with it, or how I could positively deal with different symptoms of anxiety. So for me, I knew that food makes me feel good. And I had been neglecting a lot of my cravings that I've been having, because for me, my mindset was, only eat healthy, only eat this amount of calories. And so anything that was outside of that, I would try to eliminate or push back into the back of my mind so I'd forget about it. And so because I was so deprived of these things like sugar and carbs, I started to just gorge on basically every single carb or sugar-filled food that I saw in front of me. And so this went on for about 2 hours, I would say, possibly 3 hours, where I like to compare that moment of time to like a blackout, because you kind of completely lose consciousness and your mindfulness when you're going through that period of binging, because your body is so deprived that it enters this animal-like state where it just consumes everything in its sight. And so that's kind of what I did for several hours. And then finally, I snapped back to reality and I realized what I had done. And I felt immediately so ashamed and guilty, and also really confused, because I hadn't really binged before. I was used to eating small portions and very few calories. And so consuming that much food in that short amount of time was just a really new experience for me. And for some reason, it felt good initially when I was still in that blackout kind of subconscious state. But as soon as I snapped back into reality, I realized what I had done was very odd, super unusual, very uncomfortable. I physically felt a lot of discomfort in my stomach because I was really bloated from all the food that I had consumed. And also mentally, I felt really foggy, and I felt even more anxious than I had binge eating. You end up developing a lot of anxiety, and the anxiety worsens even more the following morning, because I wake up really puffy faced, really bloated, just physically really uncomfortable. And the thing with me is that I was always just super hyper aware of like every single detail in my life, especially how other people were perceiving me. And so I was always afraid that, the morning following a binge, when I would go into school, people would notice my puffy eyes or my bloated stomach, or just that I looked different or something was off about me, and that they would be able to see right through me, right through those symptoms of anxiety, and recognize that I had an eating disorder. And that was my biggest fear. As a perfectionist, anything that would even point to a sign of struggle, I tried to deviate from, because it terrified me, thinking that people would perceive me as imperfect, because in every single area of my life, I tried to, perform. I tried to get good grades. I tried to win all of my tennis tournaments. I tried to do this and this, and basically perfect myself in every way that I could. And having this eating disorder made me realize that I wasn't perfect, and that freaked me out even more, caused me even more anxiety, and put me into a pit of depression. So it was a really tough time. And because I was a perfectionist and didn't want anyone to perceive me as anything other than perfection, I decided to keep this struggle with eating to myself. And so I didn't even tell my best friend, I didn't tell my parents, I didn't tell anyone at all, because I was so terrified of what they would think of me, because I already saw myself as this like disgusting person who was out of control, who had no authority basically over her eating habits. And I didn't want people's opinion of me to change. And so, yeah, I kept it to myself. I continued going through this cycle of restricting and then binging, restricting and binging. And at first, I refused to admit to myself that I really was struggling with an eating disorder. For one, I didn't think what was happening to me was an eating disorder, because I wasn't really educated about what I was doing, or like what it was that I was doing. Because again, in school, we covered, I think it was anorexia, bulimia, and then possibly one other common eating disorder, but we had never talked about binge eating. And for me, I also associated eating disorders with disorders where you would restrict your food intake. But for me, it was kind of a mix of both restricting and then also binging, obviously, hence the name binge eating disorder. And so it was just a bunch of confusion. So confusion, shame, and guilt were definitely the three feelings that I was feeling most during that time. And eventually I recognized that, you know what, what's happening to me is just really, really abnormal and concerning, because I could see the way it was impacting other areas of my life outside of food and exercise, which I'll get into later. So then I decided to confide in my middle school counselor. And so I went to her and I told her about how I was overeating, and her response left me pretty speechless. And it was that, so you're upset because you ate an extra cupcake. And her response was incredibly invalidating, because I already thought I was a freak for doing what I did. And so hearing that she was kind of making fun of me and invalidating my feelings or what I was going through made me want to shut down even more and not tell anyone else. And so again, I became silent for about a year or two. And then I came to my mom because I was, again, really, really struggling and I wasn't really able to help myself get through it. And so I told her what I was going through. And again, my feelings and my disorder were completely invalidated. But I do have to acknowledge the fact that my mom, both of my parents are from Russia. I'm from Russia. They were raised during the Soviet Union time. And, you know, their mindset is very different from here. It's a lot less focused, excuse the sound, a lot less focused on health and well-being. They have this attitude that, you know what, we can get through it, get over it, all of that. That's kind of what I was told: get over it, learn to deal with it. And so again, I thought that it was completely my responsibility.
Did we lose?
It was really sad because, you know, it left me feeling even more hopeless. And as years passed, I thought, there's just no way that I can get through this by myself. And so as every year went by, I just became more and more hopeless, which is really a sad thing to say. And every time I look back to my late middle school, early high school years, I feel really empathetic towards myself. And, you know, I want to tell that girl who's going through that struggle that you will get through it, which I ended up getting through it. So yeah, that brings me to March of 2020. That's last year, yes. So that is when I first started therapy. So receiving professional help for my mental health. So specifically anxiety. I did go through phases of depression in middle school and early high school, but it was mainly anxiety that I struggled from. And so when I went to therapy, we started doing a lot of work regarding childhood trauma and inner child work, and just, you know, addressing a lot of different things that I had left unaddressed for so long. And so eventually first of all, my family relationships got a lot better. And also my eating disorder just started to subside, because I was able to deal with all of these other issues that were kind of causing the eating disorder. And so as I was overcoming those, my eating disorder naturally started to move away from me, and I didn't really have that same desire to overeat or to restrict. So my entire mindset shifted as I went through therapy. I never went on any sort of medication or specific eating disorder treatment thing. It was more of just consistently going to therapy, talking through various things that were causing me anxiety or previously causing me depression and all of that. And as I worked through that, my eating disorder got a lot better. And so I consider October of last year, of 2020, my official, me officially recovering from binge eating disorder, because since then I haven't binged or restricted, and my entire mindset has changed around food, which I'm really, really proud of myself for, and also grateful to say that, because it's been a really long time. And I honestly look like, if I was to tell myself 3 years ago that I would get through my binge eating disorder, I would not believe myself, because to me at that time, it seemed like the darkest place in my life. And I really just saw no bright future for me anymore, because binge eating consumed my entire life, which is what I want to touch on now. And the fact that eating disorders don't only affect what you eat or how much you eat, they also affect your relationships and friendships, your school, your work ethic, your performance in sports, and just so many different things. Because for me, food was always on my mind, whether it was I want to eat this and I want to eat a lot of it, or whether it was I don't want to eat this, or I'm scared to eat this, or what if I have to eat this? Whatever the type of thought around food it was still there. It was in my head. Food was just my nonstop main thought that I had every single day. And so because of that, I often neglected social connection, and I decided to cancel plans all the time, especially if they revolved around food. For example, going out to a restaurant, or even going to a birthday party where I knew they would have cake or pizza or foods that I labeled as bad or, dangerous, or because they were triggering for me, because I knew that if I were to have a slice of pizza or a scoop of ice cream, I wouldn't be able to stop myself. And that really scared me. And so, yeah, for years, I would cancel plans all the time with friends. I would also show up to practice and just perform very unlike myself. I was very sluggish and slow, where before my eating disorder, I was, fast and agile, and I could do this and that, and I would want to practice more and more. But because I was eating so much, I just felt so exhausted all the time, and also just very negative. And it was a really dark time, because it felt as if everything that I had worked towards was slipping away from me. I'd always been an ambitious, hardworking kid, always strived to get straight A's in school and all of that. But it was 10, probably 100 times harder to do that with an eating disorder. And another thing that happened because of my eating disorder was my insomnia. So because my ED caused a lot of anxiety, and my anxiety caused a lot of insomnia, I basically had insomnia every single day, or every single time that I binged. And it was just, again, very dark time, which I think I've emphasized several times now. But yeah, so after 5 years of this whole eating disorder experience, what I'd realized, especially through therapy, is that seeking professional help is not a sign of weakness. Because for me, I always had this mindset through middle school and high school that I can get through anything. I don't need professional help. I don't need guidance or assistance or whatever. I can get through this on my own because I'm smart, I'm mature, I can grow, I can learn, whatever. Like, I have all of the resources online that I need. But sometimes all it takes is talking to someone and confiding in someone who you trust about whatever struggle you're going through, and that can make all the difference, and that can help you come out of your eating disorder. And so if there's one thing that you take away from this, it's that seeking help is not weakness. It's actually, it shows a lot of inner strength, and it'll help you in the long run. Because again, the longer that you keep all of these things to yourself, I think that the more detrimental it becomes to your mental health and just every aspect of your life. So yeah, with that, I'm going to conclude my little binge eating disorder story. So yeah, thank you.
Thanks, Anastasia. Just one question for you that came through is, what triggered you or made you decide to go to therapy? So what was kind of the impetus for you to make that move?
Yeah, so for me, I always had wanted to go to therapy, I think ever since freshman or sophomore year, just because I'd heard a lot of really good things about it, and I knew that it was beneficial. And I think my sister, when I was a freshman, I think my sister also started seeing a therapist for the first time, and I saw the mental health changes in her and her improvement. And so I wanted the same for myself. However, I wasn't able to go to therapy until junior year of high school because of financial hardships. And we just simply couldn't afford to go to therapy, especially when my sister was also seeing a therapist. So therapy is really expensive, and psychiatry and eating disorder treatment, all of that is really expensive. And so unfortunately, yeah, that's a huge barrier. And I wish it wasn't, because I think that therapy can help every single person, whether you're going through the deepest depression you've ever gone through, or you're just looking to get to know yourself better and figure out new healthy coping mechanisms, or just, little things like that. So.
Great. So we will ask Anastasia one more question, and then we'll save questions for the end. So Anastasia, how would you recommend a trusted adult approach you or another teen who is struggling?
So if the teen had already contacted them and told them they were struggling?
Or they saw, like, they noticed that a teen was struggling, how would you recommend that they approach you?
Yeah, I think that the most important thing to do is to avoid giving advice right away, and instead just listen openly and supportively, because something that I think, it's every person's kind kind of natural instinct to offer some words of advice or support, all of that. But ultimately, that doesn't really help the person who's receiving all of that advice, because we've all heard the common advice and suggestions and all of that. And if it really were that easy to, change our eating habits or something, we would have. And so I think the most important thing to do is to create a really comfortable, supportive, safe space for that person and tell them that, hey, I hear you. I see that you're struggling and I want to help you. Tell me how we can work through this, or do you want me to connect you to some sort of professional help? And so just make them know that you want to help them without straight up saying, what, you should do this and this, because at the end of the day, like, every person's recovery journey is very different. And so, yeah, I just say, be a supportive friend and be really kind, and definitely don't invalidate their feelings. So don't say what they're going through is, super minor and they can easily overcome it. Don't say that, because that will completely invalidate what they're going through. So yeah.
Beautiful. Thank you so much, Anastasia. Ally's turning it, or Dr. Cherkasky, turning it over to you. Sorry.
Hi. Bravo, Anastasia. Really beautiful job. And your story integrates so many things that about eating disorders, how something that wasn't intentional can spiral out of control. And as you talked about, can permeate every area of your life, your friends, your ability to play tennis, your ability to focus. Yeah, thank you so much.
Thank you, I appreciate it.
Sure thing. So it's really a privilege to be here with all of you. Thanks for coming and spending your evening with us. My intention for tonight is threefold. So one, I want to provide what I hope is helpful background information on eating disorders. I want to offer some recommendations for promoting health and resiliency in girls, in young women, in all of our children. And three, I want to hear your concerns, and my hope is to be as helpful as I can be. I'm going to open up a PowerPoint, so just bear with me. Okay, is everybody able to see that? Yeah, wonderful. Okay, good. So now, it won't let me, sorry about this, it won't let me advance the PowerPoint. Not sure about that.
That's strange. Are you?
Yeah, I'm on it. Oh, there we go.
There.
Okay, there we go. All right. So this is just an overview of what I want to talk about. So we heard Anastasia's incredible story. I want to debunk some of the most common myths about eating disorders. I'm going to tell you about cardinal features. What causes an eating disorder? We'll talk about that. We'll talk about the importance of early detection and treatment. And then we're going to end talking about how to promote resiliency, how to prevent eating disorders. So the first thing that people often ask is, what's the difference between a disordered eating and an eating disorder? And I want to explain that a bit. So all of us engage in disordered eating or something on that continuum. So I should say most of us. So if you've ever had a reunion or a wedding, or you're going on vacation, you want to drop a couple pounds, you restrict, maybe you diet, you restrict your caloric intake, you do more exercise, you become more preoccupied. This happens. Most people do things to change their body weight or shape. What a distinction is that these are transient and we bounce back. So if I were to ask this group, who here only eats in accordance with physiological hunger and always stops just before they're full? There's probably not one person here that does that all the time. We overeat for emotional reasons. We overeat because it's yummy, or we undereat for emotional reasons. So this is some degree of disordered eating is normal. When it becomes an eating disorder, I'm just going to move this. Sorry, there we go. The behaviors don't bounce back. So as Anastasia pointed out, cycles get set in motion. There's binging. And then for some people, we'll talk about different types of eating disorders. There might be compensatory behaviors. There might be restriction. So certain psychological, behavioral, and biological cycles get set in motion. And people go over a threshold and it puts them at risk of medical harm. So that's a big defining feature. And as Anastasia also highlighted, it permeates all areas of a person's life. Their relationships, their ability to work, their ability to concentrate and go to school, sometimes their financial, it can affect finances, just permeates every area, their health, their well-being. And it's a serious mental health condition and requires treatment. Okay. So I want to start by debunking myths. I have a colleague who's an icon in the field. Her name is Cynthia Bulick, and she's prolific. And she talks about these 9 myths that we need to dispel. And this is a quote from her. She talks about the single best way to fight stigma is with truths. These consensus 9 truths are the new scaffold on which we will build our advocacy efforts for eating disorders. United around these principles, we will enlighten public understanding about eating disorders and advocate effectively for treatment, access, and resources. Okay. So the first myth that we want to debunk, we want to dispel, is that you can tell by looking at someone. So you cannot tell by looking at someone whether they have an eating disorder or how ill they are. So, and eating disorders affect all body weights, shapes, and sizes. So this is really important to know. Somebody that is overweight can be as acute, as at high risk medically as someone who's significantly underweight. So this is important. Okay. All right, another myth is, I'm just trying to, okay. All right, oops, sorry about that. I just got the, somehow I blocked, there we go. Okay, another myth is that families are to blame. So a lot of people in the past, we used to talk about the pathogenic family and that what you needed to do a parentectomy and get the kid out of the family, and then the issue would be resolved. So a lot of blaming on a dysfunctional family. So what's important to know here is that that blame is misplaced, and that we know some of the strongest evidence-based treatment is family-based treatment. Families are our greatest allies and need to be included. Okay, so another similar myth is that moms are to blame. So we've been blamed for a lot in the world of mental health. If we look at throughout history, the schizophrenic mother, the cold, rigid mother, moms aren't to blame. So what's important to know is that when you have a child that has an eating disorder and you see them on a train and it looks like they're going to go over a cliff, it's terrifying and it's unsettling, and that causes disruption in the family. So it's not, the family dysfunction doesn't cause it. The fear and the anxiety of having a child with an eating disorder has a profound impact on the family. That said, there are some families that are clearly dysfunctional and not helpful, but I would say that those are outliers as opposed to the norm. Okay. The next one is that eating disorders are a choice. Nobody wakes up and chooses to have an eating disorder. So these are, this is something that, people are trying to cope with an underlying issue, and we'll talk about the different causal pieces, and things spiral out of control and go over a threshold. So nobody chooses to have an eating disorder. We know there's a strong genetic and biological basis, and this is not attributed to personal choice. To view them as that really belittles the significance of the illness. Another myth that we have to dispel is that eating disorders only affect white upper middle class girls and women. That's simply not true. Eating disorders cut across all demographics, all genders, ages, races, weight, sexual orientation, socioeconomic status. So when we ascribe stereotypes to who has an eating disorder, it's really problematic. And there's a lot of implicit bias, even among medical and mental health professionals. So who is accurately assessed and diagnosed and recommended for treatment? There's a lot of people that fall through the cracks. So across the lifespan, all demographics. The other thing is that there's a myth that eating disorders are benign. Eating disorders are not benign. These are pictures of two models that died. If you look at the gentleman on the right-hand side, this is the same gentleman. So he is quite literally physically unrecognizable. And this is another model. And what's unfortunate, I could post numerous pictures. So eating disorders, a lot of people don't know this, eating disorders have the highest mortality rate of any mental health disorder, exceeding schizophrenia, bipolar disorder, depression, PTSD, and substance abuse. So it has the highest mortality rate. Another common myth that people think is that people are likely to die when they're at their lowest weight. That is not always the case. Sometimes there's organ failure, but sometimes it's not when a person's at a low weight, but there's wear and tear on the body. But a big chunk of deaths from eating disorders are by suicide. Okay, another myth that we want to dispel is that society is to blame. So we know we live in a toxic culture. This is the air we breathe, it's the water we drink. We're bombarded by images of the thin ideal. That is toxic, for sure. But what's important to know here is it doesn't cause an eating disorder. It's a risk factor and it's harmful. But if it was the causal piece, we'd all have an eating disorder. So it's a risk factor. So genes and environment play a role. And there's more evidence now of specific genes associated with eating disorders. So if we flip to the other side of the coin here, someone can say it's all environment and others can say it's all genes. Genes are destiny. There's biological determinism. That's not the case either. So people talk about, you've probably heard the saying, genes load the gun, environment pulls the trigger. These are complex disorders that develop through an interplay of both genes and one's environment. So the good news is there's a lot we can do to buffer the likelihood of developing an eating disorder, even if someone has genetic loading in their family. Another myth that we need to dispel is that eating disorders are for life. That is not true. Some people will say, isn't it like the Achilles heel? Isn't it like substance abuse? Won't I always have a little bit of it? That does not need to be the case. Full recovery is possible. For some, there's a continuum of what full recovery means. For some, that might mean that if things aren't borne out in behavior, meaning that they're not engaging in disordered eating behavior, or they're keeping their weight stable, but perhaps they struggle with cognitive distortions or body image issues. But that's one end of the recovery continuum. There's another end where people fully recover, where they're comfortable in their body, they enjoy eating, they take pleasure. It's not, I don't know that anybody wakes up every morning and looks in the mirror and says they're perfect all the time, but people can get to a place of full recovery, and that's promising. And it's really important that we know that, because it's important in terms of just installation of hope that that's possible. All right, so I want to talk about cardinal features. What are the most common features of an eating disorder? So there's caloric restriction, not getting enough nutrition, so not getting enough calories that you need. Binge eating, which is just, what that means is eating large quantities of food within a short period of time. And typically people feel like they talk about a subjective loss of control. So I can't, like something came over me and I just can't stop. Compensatory behaviors, which means people do things to compensate for what they ate. And we'll talk about that a bit more when I get to bulimia. Body checking, this is things like sometimes people touch themselves or put their fingers around their arms. They pinch themselves, maybe getting on the scale multiple times a day, looking in the mirror. Rituals around eating, cutting things up, playing with food, and body image distortions. Okay. All right, so I want to talk about signs and symptoms. If we were to get really technical and talk about it from a mental health or medical perspective, signs are something that you see, like a sign, and symptoms are subjective and something that's reported. I didn't parse all those out. I just divvied them up into physical and behavioral. So I'm going to pull up some common themes just to be aware of. Have there been changes in a person's weight? Are they complaining about GI issues? Are they bloated? As Anastasia talked about, feeling uncomfortable. Sometimes people get bloated or have constipation or diarrhea or gas or pain. Some signs of purging, sometimes there's little tiny red dots around the eyes or in the face, and those are broken capillaries when someone has self-induced vomiting from the pressure. There's something called Russell signs, which can be calluses or cuts on the knuckles from hitting the teeth. Sometimes that can be a sign. People talk about chipmunk cheeks and that swollen bilateral parotid glands, or salivary glands get swollen, and that can be a sign of purging. Yellow skin, so this is carotenemia. People that are getting too high a level of beta carotenes from eating things like carrots and squash, and your skin can actually change color. So that's just something to note. Menstrual changes, this is a big thing. It has a lot of endocrine changes. So periods might stop or become irregular. Feeling cold, dizzy and fainting. So changes in blood pressure, that could be due to dehydration, purging behavior, caloric restriction, and dental issues can happen. Behavioral things to keep your eye out for is the person saying, I feel fat? Are they talking about food and their weight? Have they changed their diet recently? Are they going to the bathroom after they eat? We talked about mirror checking. Are they skipping meals? Are they drinking excessive amounts of water, or change in use of mouthwash, mints, gum? That can be a sign. Do they have rigid exercise rules? Evidence of laxatives or vomiting? Are they eating in isolation? I don't have here, but something I'm thinking about is coffee. Drinking a lot of coffee. Coffee is a very interesting thing because it acts as a diuretic, it acts as a laxative, and it acts as a stimulant and an appetite suppressant. So drinking a lot of coffee, something to be mindful about as well. Wearing baggy clothes. Okay, what are the primary eating disorders? So the ones that I'm going to talk about today, I'm going to talk about anorexia nervosa, bulimia nervosa, binge eating disorder. I'm not going to spend much time. I'll mention avoidant restrictive, ARFID, avoidant restrictive feeding or eating disorder. OSFED and UFED, what I'll just say here now, those are categories when there's a disturbance in eating that impairs functioning and is of clinical significance, but doesn't fit neatly into one of the other diagnostic categories. But if you can, it might be subthreshold, or it might, there's a lot of different examples. And UFED just means the clinician is not specifying what the eating issues are. Perhaps in that situation, they need to get more information. And then there's eating disorders that I don't know if we'll get to today, but there's things that aren't in the DSM that are atypical presentations. And I'm not going to talk about some other feeding issues like rumination or pica today. Okay, so let's talk about cardinal features of anorexia. So anorexia is characterized by restriction of energy intake, not getting enough calories. There's an intense fear of gaining weight and behavior that interferes with weight gain. Failure to gain weight when we should be gaining weight. In puberty, we should be gaining 30, 50 pounds. In pregnancy, we should be gaining 30, 40 pounds. In menopause, women don't talk about this. We should be gaining 10 or 15 pounds. That makes sense. That's normative. That's like a second puberty. Body image disturbance. And there's two subtypes with anorexia. You can have restricting type, where it's caloric restriction, or you can have a binge purge subtype, where you're engaging in binge eating and purging behavior. I referenced earlier atypical anorexia. I'm really glad that they included this under OSFED. So this is people that are not at low weight. Someone can be normal weight or even overweight and have all the signs and the symptoms and the criteria of anorexia. And they are, again, I want to emphasize, as much at risk for significant medical consequences as someone of low weight. All right, so bulimia nervosa, we talked about what a binge is. So binge eating large amounts of food, discrete period of time, loss of control. Compensatory behavior. So this is anything that the individual will do to decrease what's been consumed or to avoid weight gain. It's to compensate. So things that common compensatory behavior are self-induced vomiting, laxative abuse or enemas, diuretics to rid the body of water, fasting, compensatory restriction, compensatory exercise, or Ipecac, which is a drug that is often used with a child who gets into a medicine cabinet. Very, very dangerous. Someone can go into cardiac arrest when that's abused. And self-evaluation is unduly influenced by body shape and weight. All right, binge eating disorder. So this is what Anastasia so eloquently talked about. With binge eating disorder, it's very similar to bulimia, but there's no compensatory behaviors. So there's episodes of binge eating. Often people eat more quickly than normal. They eat until they're uncomfortably full. They might eat large amounts when they're not hungry. Eating alone, I made some my edits and it didn't go through, so my apologies. Eating alone because of embarrassment, maybe feelings of self-disgust, depression, guilt, and distress. No compassion. Yeah, please.
Dr. Cherkasky, we have a question. What is the difference between binge, purge, anorexia, and bulimia?
Beautiful. Great question, because it's confusing, especially because I just said that weight isn't, one can go into an atypical. So the biggest variable in terms of a hard and fast thing, we would look at low weight. Now, if somebody, so anorexia is generally characterized by low weight, except we talk about atypical. Bulimia, you often see with average weight or overweight. Binge eating disorder, you can see with average weight or overweight. Someone who meets the criteria for atypical anorexia would not be in the binge purge subtype, because if they were, then it would be bulimia. Does that make sense? I think what's important here that we're bringing up, which is really critical, is there's significant crossover. So one person, it's very common for one person to have one eating disorder and for it to shift over time.
Absolutely.
I also
Great.
wanted to add in
Please.
that I think it was freshman or sophomore year. So I started working out with some football trainer person in order to, gain strength for tennis and everything. And there was, I think in the beginning, a fitness test where they also tested your BMI, and mine ended up being below average because I was so active. And so during that time, that was my peak binge eating time. And so, but I was not overweight, and I never have been overweight. And so I think that, again, this whole weight thing is just on a spectrum, because for binge eating disorder, you can be, I don't know about underweight. I'm not a professional in this, but you can definitely still be normal weight or overweight, obviously, and not really even show signs of abnormal eating patterns. Because, for example, for me, I also, because I was so self-conscious about my overeating, when I was in public, like with friends or at school, I would try to bring relatively small portions, even though I knew I should be eating more. I just was so concerned about how other people would perceive my portion sizes, or if they would think, oh my gosh, she's struggling with eating, or she has an eating disorder. So I would try my hardest to hide any sign of eating struggles, and especially overeating. So yeah, I would try to basically fake the amount that I ate. Then when I was in private and at home, I would eat larger portions. So
Thank you. Thank you. So ARFID, I'm just going to mention super quickly. This is a new diagnosis in the DSM-5. It's more than picky eating. There's different origins. So it's when someone really cuts out and restricts food groups, and it puts them at risk for nutritional deficiencies and at risk for medical complications. And if they're young, they're not making the expected growth. So ARFID, the cause, it might be a sensory issue, maybe something they don't like the way it tastes, maybe they don't like the color of the food. Some people have had a trauma, or maybe they've choked on something, or they've seen someone choking, so they don't want to eat solid foods. So, okay. And here, a major distinction with ARFID is there is not the body image distortion. All right, so let's go on. So medical complications. So just really quickly here, eating disorders affect every organ system in the body. There's nothing that is spared. So we could go through every single thing here, and there are short and long-term effects. If we had more time, this could be a whole 3-hour talk, but it affects every organ system in the body. Some things can be recovered, others are much harder. So if we just look at, brain, everything, hair, heart, cardiac issues, blood, skin, kidneys, muscles, intestines, hormones, affects everything. One thing that's really important for folks to know is bone health. That's a really critical piece. Bone health is hard to recover, and I've worked with women who are in their 20s and have the bones, who have osteoporosis and have the bones of an 80-year-old, and that's virtually impossible to recover. So really, really tricky. So long-term consequences. You can lose bone health in a year of significant restriction or less. Okay. So let's talk about what causes an eating disorder. A lot of people want to know, if I could only identify the root cause, if I could get to the bottom of it, I could figure out the eating disorder. And so what I want to emphasize, there's no one root cause. There's no single factor that's necessary and sufficient to cause an eating disorder. It's a complex interplay of genes and environment. So here we have biopsychosocial variables. I could list 15 more in each of these. So it's understanding, instead of thinking about what's the underlying etiology, what's the origin, now we talk more about risk and protective factors as opposed to etiology. So when I think about each person, for lack of a better image, I think of like a pie chart, and each person's piece of the pie is different. So maybe for some, there's a lot of genetic loading. Maybe for others, there's more of an environmental influence. Maybe for others, there's more trauma. So it's understanding what are the variables for this person, and that's going to help us think about how to best intervene. And the other thing for any of my students that are in the crowd today, you hear me talk about the 4 Ps over and over, and that's that there's predisposing factors, those that increase the likelihood of something. There's precipitating factors, that kind of the straw that broke the camel's back, that tips it over, that triggers. There's perpetuating factors. Those are the things that maintain the behavior. And there's protective factors. And what's interesting is if we look at each of these concentric circles, we could apply the 4 Ps in every circle. All right, so genes, I mentioned Cynthia Bulick. She's leading the research on genetics and eating disorders. She's done this incredible multi-site ANGI study that looked at over 1,300 people with anorexia. And these GWAS studies, these are genome-wide association studies. This is a burgeoning field where in the past, to understand heritability, we used to look at twin studies, monozygotic and dizygotic, is it, fraternal, identical and fraternal. And then we'd look at like how similar genetically is someone. Is it a first degree relative? Is it a second degree relative? And we would look at conditions this way. Now the human genome is mapped, which is amazing. So what we know, eating disorders are heritable. They're heritable. And there's just as much heritability and biological underpinning as schizophrenia, as Tourette's, as bipolar disorder, as OCD, spectrum disorder, as substance abuse. What Cynthia Bulick is looking at, her studies, which are really fascinating and cutting edge, is she's reconceptualizing anorexia as what she calls a psychometabolic condition, because she's looking at all different things like BMI and lipids and fasting glucose and insulin, and really, really interesting stuff. Okay, so let's look at psychological factors, some risk and protective factors. Risks, low self-esteem, feelings of inadequacy, tendencies toward perfectionism, obsessive compulsive traits, depression, anxiety, psychosocial stress, overvaluing body image and defining one's self-worth, harm avoidance, so anxiety traits, social anxiety, okay, and heightened sensitivity to others' negative evaluations. So protective, and we're going to move into resiliency soon and talk about protective. High self-esteem, body, positive body image, media literacy skills, we'll talk about that, emotional well-being, school achievement, being self-directed and assertive, good social skills. Okay. Family does not overemphasize weight or physical attractiveness. I cannot emphasize this enough. and families that eat together. All right, psychosocial risk factors. Internalizing this Western beauty ideal. The societal pressures to be perfect.
Dr. Cherkasky, we just had a question for you related to your last slide. Can you
Sure
describe
thing.
what, can you describe a little bit what harm avoidance is?
Yeah, you know, there are risk takers, and then there are people that, you know, the people that want to go on like the roller coasters and skydive. And I'm like the type of person, if I'm high up in a building, I don't want to get too close to the window and look down because I get very anxious. So there's harm avoiders and risk takers. So it's sort of like a temperamental style.
Right. I often describe it as we're trying to get people to avoid the behavior that's going to lead them to the psychological, to the problem. So you're trying to literally avoid the harmful behavior, but you're not stopping it. You're not restricting it and saying like, no, you can't do this. Because if you think about teenagers, particularly, once you tell them, no, you can't do it, then like, oh, hey, like, I'm going to do it. So it's this idea that like, it's an option, but what are some of the other things that we can do to avoid that option, I think.
Beautiful. Absolutely. Yeah. Peer pressure, teasing or bullying, especially when this is around someone's weight and body shape. Trouble or stress with interpersonal relationships and in the family, social media. Protective. So a culture that celebrates body diversity. We're going to talk about that momentarily. If they're involved in a sport, the coach does not overemphasize weight or body shape. The primary supports in your life emphasize who you are as an individual, not what you look like. No body shaming zone. That's important. Okay, so before we're going to go into resiliency, but I just want to say a couple things about treatment really quickly. With eating disorders, it's not a one-person show. You need a treatment team. That's the gold standard. So you need a primary therapist, and you need a primary therapist is doing the counseling or the therapy. There's a medical professional that's monitoring all the risk factors and medical signs, a registered dietitian to help with the meal planning, and sometimes a psychopharmacologist, a prescriber. So what's critical in eating disorder treatment is that people are working together and collaborating closely. There's different levels of care. There's inpatient, residential, partial day hospitalization, IOP, which is like usually like an evening, 3 times a week. Partial hospital is like a day program, and then outpatient. So the most important thing is that someone is evaluated by an expert in eating disorders so they can match acuity with level of care. That's really critical. And also we have to understand it's very rare for someone just to have an eating disorder. Eating disorders are associated with multiple psychiatric comorbidities. So we see mood disorders, we see anxiety disorders, we see OCD spectrum disorders, sometimes trauma and substance abuse. So those are common co-occurring disorders. All right, now we're going to get into the good stuff. Resiliency. How do we help people so they don't develop an eating disorder? So let's jump in. So let's talk about starting at home. The first thing that I'm going to ask all of you to do, all of us to do, is to take an inventory of our own relationship history with dieting, food, weight, and our body. So none of us is immune to difficulty. So what are your rules? What are your food rules? Do you have good and bad food? Do you talk about your weight? Do you think about your weight? Do you count calories? Do you get on the scale? What do you exercise for joy or to burn calories? So really thinking critically about that it's hard to create a healthy environment if we haven't healed our own wounds. So do what you need to do to make peace and understand and work on it. And you don't have to be perfect. We can work on things with our kids, but really understanding the messages that are being given, the unspoken and spoken messages. So eating together and having meal times being a time to connect with each other. Working to increase presence with each other. How do you unplug? You know, at family time, share a high and a low of the day. Have each person choose a favorite meal, make it together. Promote healthy eating, but not having militant rules. You never ever want to punish with food or withhold food from one family member, not another. And you want to try not to associate food with regulating emotions. So you want to teach strategies about and structures for activities for self-care. And as I mentioned, being very mindful of the messages you give, either about yourself or other people, that's around appearance and weight, because these messages can be very destructive. Focus on their efforts. Who are they as individuals, their character, kindness, their gifts, what makes them unique. I love your, I looked on Gateways and I loved you have the mitzvah mensches. I thought that was wonderful. So who are your superheroes at home? Who do you talk about? Who do you look up to? That's really important to think about that. Exercise and healthy eating for exercise and eating for health, for joy, for brain health, for body health, but not to burn calories and not to be a certain number on the scale or not to be a size or a weight. Intuitive eating, you know, getting kids to check in and how does it feel when you eat that? How does your energy feel? How does your mood feel? How does your focus feel? How does your GI system feel? Eliminate fat shaming and body shaming and fat talk, and share the dangers of dieting and emotional eating. And if you see signs, seek help early. Okay, and the mitzvah mensches, who do you want to be? Model that, model those heroes. Just really quickly, Rachel, if you can hear me, do you know what slide I'm on, just to kind of gauge? I know we're coming, I want to have time for questions. I'll just say really quickly, there are a lot of prevention programs, and this is one that I love. This is put out by a colleague at McLean, and it's a primary prevention program which aims to get in there and prevent an eating disorder from ever happening. And they look at things like body pride, body acceptance, healthy eating habits, leadership, media literacy skills, coping skills. How do you resist unhealthy peer messages, different cultural messages? So I was going to talk a little bit about their studies, but I'm not going to, just to say it's just a wonderful program. And there are a lot of these programs. So get these in your schools.
You are on slide 30, so.
Okay, so, all right. I'm just going to move through. This is just a quick slide that's going to, you know, so we're talking about starting young, but then preteens and adolescents. Why not talk about sex ed as something about empowering health and well-being? This has a direct relationship with our bodies. So, you know, a lot of kids, unfortunately, learn about sex through porn, and those are the models. So why not talk about healthy relationships and how to identify signs of an abusive relationship and how to assert your needs and communicate well. All right, celebrate body diversity. This is a brilliant quote. I'm gonna let you read it. I'm not gonna go read it to you. It's by a 14-year-old that talks about, I know just in the interest of time, why BMI is problematic, and it's problematic for a bunch of reasons. It's not a measure of health. It's a measure of weight and height. It doesn't account for genetics, bone structure, muscle mass. So it's really problematic. And I'll read the ending. BMI is an outdated way of determining a person's body health, and it's a measurement that should not be used in a school setting where students are already self-conscious and lacking confidence in their unique bodies. I can't tell you how many people I've seen that went to a doctor and they said, your BMI is too high. They put them on a diet, and that was the trigger for the beginning of an eating disorder. All right, coaches, help them understand the signs and the symptoms, that warning signs need to be taken seriously. De-emphasize weight and focus on strength and mental and emotional aspects of performance. Don't assume that weight is going to enhance performance, because often there's a significant cost, and that's the person's health. No body shaming. We all know that high school, it's a time of real sensitivity around self-esteem and weight. Have coaches emphasize the health risks of low weight. And there's something, a female athlete triad, which we see with women, where there's disordered eating, loss of menstrual cycle, and osteoporosis. This is a quote I love by someone in recovery. I am beginning to measure myself in strengths, not pounds, sometimes in smiles. I love that. Okay, media literacy. Just really quickly, it's about educating people about the media so they can deconstruct it, because so much is warped and morphed and changed. This is, we won't have time to do it today, but check out the Dove Campaign for Beauty. This is a video, it's a minute long, and it shows all that they do to morph people, like computer images, and the person is transformed, and she's unrecognizable to herself. It's really worth seeing. Okay, so messages in the media. This is what we see. We see all sorts of stuff. Jean Kilbourne has done a series, Killing Us Softly. She talks about so many different themes, how women are objectified, how adult women are infantilized, how young women are sexualized. It's, you know, we can look right here in some of these, you know, it's obvious what the message is. We see a woman here. This is for an anti-aging cream. I don't know. She doesn't look 18 to me. So instead of seeing this, what if we saw more of this? So messages that empower and that embrace and that celebrate who we are and our differences, and that there's beauty in what makes us unique. So impact of social media, really quick. I know this, the students, the young people know about how toxic it can be. So we know that viewing fashion magazines before social media, we knew that there's a direct correlation between how we feel about ourselves, our mood, our self-esteem after viewing a fashion magazine. The problem now is with social media, the comparisons are no longer about celebrities and athletes, but those in our social circle. So we know they're highly curated, they're touched up, they're really problematic. And also there's easy access to, there are many communities on social media that they're pro-eating disorder. So they pull people in, and they're very, very dangerous and toxic. So we also know, just looking at studies on happiness, that more social media, so independent of eating disorders and self-esteem and, you know, awareness of body, increased isolation, feelings of inadequacy, depression, and anxiety with more social media viewing. So what can we do? And here, reminding people that number of friends does not mean quality connections. So what can parents do, and teachers? These are some things I'll let you read. Education, again, this literacy, so they understand. Praising character traits, finding times to unplug, having people ask, am I comparing or am I connecting? This is just some quotes by Rumi that when they look at social media, is it true? Is it necessary? And is it kind? And does viewing this, does time spent here promote my well-being? So those are questions to think about. And follow people that you're inspired by. Follow those superheroes who are mensches. All right, we're almost done, a couple more minutes, and we'll turn it over to questions. Pillars of wellness. So these are things that I emphasize with everyone in my life, with my students, with patients, with colleagues. These are things that are seemingly simple, but there's science behind every single thing here. So these are, I have EBT, this is evidence-based practice. So diet, and here I mean, not being militant, but being aware of how food impacts us. Exercise, it doesn't have to mean going to the gym and doing a power workout, but moving our bodies. And again, diet and exercise for health and joy. Not being a number on the scale. Sleep, restorative sleep hygiene principles are critical for our well-being. Teaching kids stress management skills and coping. The power of connection and meaningful activity and choosing joy. My last slide is destigmatizing mental health disorders. We need to talk about it. We need to dispel the myths and misconceptions. This is not the other, this is all of us. And I just want to say a wonderful way to destigmatize mental health disorders are having brilliant, exceptional, courageous, resilient young people talk about what it means to be human. So thank you, Anastasia, for doing so and for being our role model. Thank you.
Thank you.
Thank you. So a question for you that came in, Dr. Cherkasky. How do you determine what a healthy weight is?
Yeah, that is a great question. So here's the thing. I like that there's this term that we talk about in the field called health at every weight. So I don't like healthy weights. Let me start there. I don't like BMIs. I don't like healthy weights. The thing that what I would focus on with someone, are they engaging in disordered eating? So you want to understand that and then get help. Are they engaging in emotional eating? And if so, learning skills to deal with that. Are they doing things for their well-being and health? So we come in all different beautiful shapes and sizes. So I don't like the term healthy weight. I think there's so many different weights.
Great, thank you. Is overeating, another question, is overeating a disorder or just a risk factor?
Yeah, so that's a great question. So overeating is not a disorder. It's interesting. People talk about, is there a continuum between compulsive eating or overeating, emotional eating? They're kind of, there is likely a continuum. The thing that, yeah, no, it's not a disorder, but I would pay attention to it if it's causing someone distress. And it might make sense to think about, there are skills, I won't be able to go into them now, but there are skills to teach people to listen to feelings of satiety, hunger and satiety skills, and how to look at kind of a range and how to tune into that. And you can Google that a little bit, like hunger scale, intuitive eating, what does that mean?
Other questions? We have a few more minutes.
And also, I don't know if questions are coming in, but I don't know if Anastasia, if there were any things I touched upon that you wanted to share. Yeah.
Yeah, there was a part when I think you were covering the coaches slide and how coaches can be supportive to athletes who are going through an eating disorder. And I just wanted to share a personal little story of mine. So when I was texting my coach, I believe it was Thanksgiving of last year, and I was just, saying Happy Thanksgiving. And I was telling him about everything that had happened this year because I stopped playing tennis about a year ago. So I haven't been in contact with him for a while. And I told him that I'd finally recovered from my eating disorder that I'd had for 5 years, basically. And he said that he had no idea that I had an eating disorder. And he was one of the primary people that I saw throughout the week. I went to tennis practice probably 5 days a week on average, sometimes 4 or more. And so I would see him often. And that just proves how well hidden eating disorders can be, especially if the person going through an eating disorder is similar to me and a perfectionist and wants to appear perfect in every aspect of their lives, because they're concerned with what other people think of them, and they're also concerned about their own the way that they think of themselves. And so eating disorders are really tricky. And again, although there are similar symptoms among them, again, it's a very individual, unique experience to each person because everyone goes through their own journey and recovery process. So yeah.
And I want to highlight that while this series is geared towards females, that eating disorders are not just prevalent in females, that they do exist in males, and that many of the same warning signs can be present for males. And at times warning signs can look a little bit different in males. Sometimes we see a lot more focus on building an upper body in a certain way. So those are all important things as well. Somebody asked just now, well, before I ask this question, do you want to add anything, Dr. Cherkasky, about eating?
I'm so glad that you said that. I'm so glad that you said that because they absolutely affect boys and men. And what you are referring to is there can be muscle dysmorphia, which some people talk about as reverse anorexia, where there's an obsession about being too puny. And so wanting to build up as much muscle mass. That said, there are also men that can present with more of a prototypical anorexia or bulimia or binge eating disorders. Absolutely. So this is all genders. Thank you.
Somebody asked how you would recommend finding the right therapist. If you want to answer that one, it's tough.
Yeah, that's a great question. Well, I would say this: there's no perfect theoretical orientation or approach to deal with eating disorders. So I would, I think, finding someone that one you connect with, and that you have you feel comfortable with, but someone that understands eating disorders. So they're going to know how to work with a team, how to help you set up a team, and how to know if the person needs a higher level of care. That's really important. MEDA, the multi-service Eating Disorders Association in Newton, has a wonderful referral database that you can reach out to and say, here's my insurance, here's where I live, and they can give you a bunch of names.
Great. Another question that just came in, can eating disorders develop in adults, or was it present and just not acknowledged when they were younger?
Great. So Cynthia Bulick has a wonderful book called On Midlife Eating Disorders. She talks about 3 groups. So one who's had consistent eating disorders their whole life. Another that it's gone into periods of relapses and remissions. So maybe during menopause or when the kids leave or there's a divorce or a death, there's a resurgence. And then you have a subset of people with an onset later in life. That's rarer, but it certainly does happen. And the numbers of middle-aged and older women that engage in diet behavior and obsessions about their weight and their body, it's quite astounding. So absolutely, across the lifespan.
Somebody just shared that this webinar really spoke to them, and I'm so glad to hear.
Thank you.
Other questions?
I also wanted to add something about social media, and obviously throughout the pandemic, my generation has definitely turned to social media as a pastime. And I'm personally not on TikTok, but I know that there's a lot of people, especially like my friends, are all on TikTok. And I know that there are a lot of videos about different diets or what I eat in a days. And sometimes I have seen some of them because my friends have sent me them. And I'm quite shocked by the amount of nutritional information that's out there that isn't regulated and that isn't provided by licensed dietitians or nutritionists, because it really worries me, because I was in that position of a vulnerable 13-year-old who was concerned about her body image and her performance as an athlete. And so I turned to social media, and I relied on solely social media, primarily Instagram and different influencers on Instagram, to kind of guide me with my dietary changes. And that resulted, obviously, not a very good thing, in eating disorder.
Yeah.
And so I don't know exactly how we can our generation about developing healthy eating patterns, especially when they're on social media so much, and also look up to a lot of people on social media and all of these body ideals that are presented on different social media platforms. But I definitely think that schools can make more of an effort to provide thorough education about nutrition and eating disorders, because I personally did not feel very supported at my school. Again, every public school system, I believe, is quite different, and especially if you're in private school as well. So I don't know exactly what the curriculum is like for health classes in all of the schools across America. But personally in mine, again, we, as I said before earlier in the presentation, we only covered bulimia, anorexia, and then I think maybe even just those two. I honestly can't quite remember, and very little about the foods we should be eating or what we should do if we want these type of changes or whatever in our body. And so I think that if we invest more in our education system to educate us about nutrition and exercise, then I think that there will definitely be a much more positive change regarding like eating disorders among the generation. So yeah.
Beautifully said.
So
I agree.
I want to be mindful of time. So if Dr. Cherkasky, and Anastasia, if it's okay with you, what I'm going to do is do some announcements. And then if you don't mind hanging out for a few more minutes, there are a couple of lingering questions.
Absolutely. Happy to.
Okay, great. So just in terms of announcements for people who have to jump off, we are going to be sending an email tomorrow with the slides, a survey, a resource list, and also a link to register for a follow-up next Monday, where we can have an interactive discussion. I'll be facilitating about any kind of questions that come up from tonight or things you'd like to discuss further. And then our next webinar will be on April 14th. And the topic for that is self-injury and suicidal ideation. We're particularly focused on self-injury and what we know and how we can help our youth with that, and our resources for educators and parents. And that will be our keynote, our speaker for that is Dr. Ashley Warhol, who is a clinical psychologist. And we will also have another teen who, similar to Anastasia, who will share their story with us. So those are my announcements, and now I'm going to move back to these questions. So the first question that just came in is there often denial? And if so, how do we determine what's happening?
Great question. Yes, and that's actually a criterion. I didn't go through every single diagnostic criterion, but with especially, with anorexia, denial of the seriousness. Absolutely. Anastasia, is there anything you want to say about that? I didn't know if there was anything there with denial.
I'm sorry, I was confused with the other Q&A questions. Could you repeat the question?
Sure. If denial is common.
Oh, I think so. I mean, in the beginning, I refused to believe that I had any issue with eating, even though every week I was going through a binging period. I think it's especially at such a young age, it's a terrifying thing to admit to yourself that you have an eating disorder, because, when you're growing up, like one of your biggest fears is basically developing an eating disorder because of the stigma associated with it and the idea that it's life-threatening, which it is, but it's just really scary. It's a really scary concept to accept at such a young age. So I think that denial is very frequent among people with eating disorders.
And I think part of this is, as we've been talking about, it sounds like the whole series is destigmatizing mental illness. So, talking about it is really key.
Thank you. So somebody asked, we are a family that values healthy eating, limiting processed snacks, and food, and sweets, although we do not restrict the kids. For example, we are okay with them having chips as a snack, but tell them that it's great to add fresh fruits and veggies. I've noticed that when they get to friends' houses, they have unlimited junk options, and my kids tend to binge on them there. They refuse the healthy options and just want to get their fill of the processed foods. Could this be an indication of some sort of start to an eating disorder? Obviously, this is something we want to avoid, but are having a hard time.
Yeah, that's a great question. And a lot of people talk about kind of the line between, disordered eating disorder, and weight issues, and how do you kind of bridge all of that. And I think, I don't know if this is like a perfect, crisp answer, and it's probably not, but I think the message for the whole continuum is diversity of food, health, focus on eating and movement for health and wellness. It's interesting. I guess what I would pay attention to is kind of how often this is happening. Are they concerned? Are the kids coming home and feeling in physical pain and sick? Or is it more, that they had stuff a little bit more, certain things that they don't have at home as a treat? So I would kind of watch for it, but and focus on, again, the whole continuum, health and health and moderation.
Yeah, I just wanted to quickly add that I think it's also important not to label foods good and bad, and to have such a black and white definition of what is healthy to consume, because I know that for me, one of the triggers for my binging was that I was restricting so much because I wasn't allowing myself to have the foods that I considered bad. For example, like cake or just processed foods in general.
Yes.
It really is okay to have, chips or cupcakes or whatever you like, candies and all of that every now and then. Again, everything in moderation is totally fine. But when you develop that mindset that one cupcake is awful and it's going to ruin all of the fitness or dietary progress that you've made, then it becomes really toxic. So I would watch for that.
Yeah, and you're talking about something really important, that black and white thinking, that food isn't inherently good or bad, and that people that binge eat often have hard and fast food rules. And the more they restrict, then the pendulum swings. So it's tricky when you have different kids dealing with different issues. So someone dealing with that type of behavior, you're trying to move away from hard and fast rules. If someone is dealing with more weight issues and you're trying to cut back, I want to acknowledge it can be tricky. It's not simple. But I'm glad that you talked about with folks with eating disorders and disordered eating often have food rules that, my clean food, my diet food, my good food versus bad food. So thank you.
Great. Okay. Thank you, everybody. This was a really wonderful presentation. Again, please fill out our survey that will be sent out tomorrow. We really welcome your feedback.
Thank you so much. It's a pleasure being here.
Thank you. All right.